Are you someone with long COVID or PASC and you've tried all the protocols out there and you're still not better? In this video today, we're going to discuss some of the reasons why that may be and how we can go around approaching long COVID or the long COVID phenomenon in the future as we start to see this becomes an endemic. It's been 4 years since the pandemic started, and we're now starting to see that, acute infections are still going to remain with us every year. However, it's much more easy to manage that. It's not as severe. However, the main concern for us now is the onset and risk of developing something like long COVID. So far, what we've seen is a real lack of certainty and understanding about what to do with long COVID, especially in the mainstream conventional approach. So many people have gone around researching their own, finding various health experts, doctors to guide them on what protocols might be helpful in their recovery from long COVID. And thankfully, a lot of highly intelligent doctors, organizations have put a lot of focus on helping this population and putting together protocols, solutions that may help them in their recovery. And for many people, this has been a lifeline and has generated some positive results for them in repiecing their life back together. However, it's important to recognize that many people actually haven't responded well to these protocols and they're still sick. So why is that? Well, firstly, we know long COVID or PASC is a very complex condition. There's up to around 200 different symptoms that can occur, and it can vary from one individual to the next. So therefore, it makes it very difficult to generate a one-size-fits-all approach when we have so many different types of manifestation of the same condition. And this really highlights the limitations we generally have within our mainstream approach to chronic illness as a whole, is that we try and use one pill or one solution to treat every single person with the same condition. And often these solutions generally involve suppressing the symptom, getting symptoms under control, which is an important first step for people. However, when we look to really helping this person recover from illness, we start to understand more and more that for the two people with the same condition, we can have very different causes for that, and therefore we need a very different type of treatment plan for each individual. If we pick the symptom of fatigue, for example, we know fatigue can happen when there's been a viral infection and post-viral effects, but for another person we know that toxins may be the issue for them, as we know toxins can really inhibit mitochondrial function in the body and therefore energy production. For another person it might be purely nutritionally driven, or they're maybe not absorbing nutrients well through the gut. So when we want to help these individuals really recover from illness, it really takes an individualized approach and sitting down, discussing with that individual what has really happened to them to understand the specific factors which are influencing their health. And this again highlights another limitation with our mainstream healthcare system is, our GPs, our mainstream medical doctors, they don't have the time to sit down with a patient, every single patient, and have this in-depth conversation to really identify those specific factors for that person. Another issue with long COVID is, what are we even treating? What even is long COVID? As we said, there's around up to 200 different symptoms, and all of these are being driven by different mechanisms which can occur in different people. But what we start to see becoming evident in research and in our clinical experience with long COVID is that what seems to be what we consider a pure long COVID case would be this phenomenon of vascular inflammation. So what happens with this is that the virus comes into the body, especially through the lungs, gets from the lungs into the bloodstream, into the blood vessels, and there it can start to cause inflammation to the endothelial lining of the vascular system. And this in itself triggers the onset of this phenomenon we see, increased platelet activation and coagulation. So a lot of people in this type of scenario are seeing this microclotting effect happen. And what we know about this, what's becoming more clear, is that it's this phenomenon, the platelets, the increased coagulation, causing decreased blood flow around the body. And that's generating a lot of symptoms like shortness of breath because there's not enough blood flow to the lungs to pick up oxygen and distribute it around the body. Now, what we tend to be seeing is that a lot of people that follow the protocols which are set up to manage this type of scenario, they seem to be the ones that are responding well in this pure long COVID vascular inflammation case, which is being discussed a lot about people with like Bruce Patterson. A lot of his diagnostic procedures and interventions all surround this type of scenario. However, what we know about long COVID is that there are many underlying issues going on which can contribute to the whole condition as well. And as Dr. Salibi has discussed in some of his interviews, another prevalent figure in the long COVID space is that over time we're probably going to see long COVID or PASC as a type of syndrome where there's not one clear cause, but it's this complex imbalance in physiology with multiple different causes. And it's likely that the people that haven't responded well to these protocols likely have some underlying things going on which are contributing to the whole condition. So we know with long COVID pathology that a autoimmune or heightened autoantibody phenomenon is occurring. There seems to be a high correlation of autoantibodies circulating the system, or some people have even had a major diagnostic autoimmune condition triggered through this event. And that's because SARS-CoV-2, just like viruses like EBV or herpes type 6, they can play a role in triggering autoimmune disease. That's well established. However, it seems to be that these autoantibodies, they play more a role when there's lots of inflammation being triggered in the body. When the inflammation is decreased, we remove factors which are causing inflammation. These autoantibodies don't play such a damaging role. So therefore that opens up a whole discussion and big area to focus on with someone is, okay, what's causing inflammation with them? And that can be so many different factors for them, whether there's underlying toxins, whether there's other infectious stuff going on, whether there's food sensitivities occurring, whether stress or trauma are a factor. So therefore, immediately we already see how individualized this can become when we talk about approaching these people. But it seems to be using anti-inflammatory interventions do generally help the long COVID population. That's generally why this is going to work for them. Another mechanism that we know is a big one for long COVID is viral persistence, or remnant debris of the virus in the system. So it seems to be that majorly we get the virus persisting, especially in the gut. And that can be triggering ongoing immune activity, ongoing immune reactions, which are perpetuating the inflammatory cycle. In relation to the gut, we know that also dysbiosis is another factor playing a role. So we know that when people catch COVID, there's a big disruption to the microbiome in the gut. So we start to see afterwards there's a decrease in beneficial bacteria, which provide a lot of the anti-inflammatory compounds and things like short-chain fatty acids. They tend to decrease. So we get less anti-inflammatory effects in the body, and then we get an increase in like bad opportunistic bacteria and microbial species, which put an additional load on the body. They promote more inflammation in the body. Coming back to viruses again, we know that it's not just SARS-CoV-2. We know that we can get a viral reactivation phenomenon. So things like EBV, HSV6, like we mentioned, these things can remain dormant within the body. We know, like, all of us generally catch EBV and it remains in the body for life, and it remains dormant and being controlled by our immune system. But with the SARS-CoV-2 infection, that seems to overwhelm our immune system, so it can no longer keep under control these dormant things, and then they start to flourish and exert a stress and a burden on the body. Again, not just viruses, things like Lyme can also be ongoing underneath. And with the same mechanism, you know, the immune system gets overwhelmed, can't control these things, they start to flourish and come out the woodwork more. And therefore, it becomes unclear what we're really dealing with. Are we dealing with, you know, inflammation or autoimmunity, or is it SARS-CoV-2 persistence, or are we dealing with more of these other chronic infectious stuff going on? So it becomes way more complex. But we tend to see this area of reactivation of things like EBV and HSV6. It's a big reflection that the immune system is quite exhausted. Especially T helper cells need a lot of support to get back on track to keeping these under control. And there's many factors that play into that. We also know that ACE2 gets depleted in the body. So we get an ACE2 depletion. And so what happens is when SARS-CoV-2 comes into the body, it enters the cell via the ACE2 receptor or ACE2 enzyme. And as part of that process, the enzyme, the virus getting into the cell through ACE2, we actually get a destruction of ACE2. And ACE2 is involved with a lot of regulatory processes in the body. So recovering from this and recovering ACE2 levels in the body takes a long, long time. And it's really heavily related to things like diet. We especially want to get a lot more phytonutrients, a lot more color into the diet to help this process. If you need support in doing something like that and really building up the foundation of your diet and getting more color in, we actually have an online course coming out very soon, and you can sign up for that now with the link below this video. And then we have some major mechanisms responsible for a lot of the symptoms going on. So things like MCAS, there's definitely a group within the long COVID population which carry a more MCAS type presentation, and that's all to do with histamine releases and the symptoms generated from that. A lot of things like brain fog, fatigue, rashes, hives, allergic type reactions, sensitivities to a lot of environmental things, a lot of foods. And that can be really tricky to navigate because they're just so sensitive to things. You're trying to provide them interventions and they just react to everything. And this is exactly where a lot of the antihistamine medication and treatments have come into a lot of protocols and approaches for long COVID. And it seems to be the antihistamines really help people just get things under control, but it doesn't get them all the way, because we need to question, okay, what's actually causing the mast cell to keep activated and keep sensitized? Because it seems like SARS-CoV-2 switches on the mast cell, so it starts to become very sensitive. However, and we can use things like antihistamines to reduce histamine. We can use things like quercetin, luteolin to really stabilize the mast cell. However, if the mast cell is now seeing things that it doesn't like in the body, if it's starting to see things like viruses, if it's starting to see bad bacteria in the gut, if it's starting to see other things which are generating a lot of the inflammation, it's going to keep reacting. We need to address those things to really get someone off the antihistamines back to being really well again. And another big group of symptoms revolve around this POTS-like phenomenon or autonomic dysfunction. And this is majorly being driven by, inflammation in the body. We know the brainstem is very, very sensitive to inflammation. So you really need to get a handle on inflammation to get POTS and things under control. So as we can see, this is really complex. There's a lot of stuff going on here. So it's unrealistic to think that one protocol is going to fix every single thing with every single person. And again, it's likely that if you haven't responded well to a protocol or treatment, it's likely because you have an underlying thing going on which is unique to you as an individual. And therefore, if you're one of these people that have tried these generalized approaches, you now need to do the individualized work. Work with someone one-to-one to identify the individual factors playing into the condition for you. And yes, this is hard work. Recovering from a chronic illness like long COVID is difficult, but it can be done. If you can find someone to work with that can identify the specific things playing into this for you, you're going to remove a lot of the uncertainty which you're now facing, which is also driving a lot of the anxiety for you. So that's the first step, is getting clarification what to work on. Then you start that journey. One of the best people to use for something like this is, of course, a functional medicine practitioner, because they know really where to look for where inflammation is coming from the body. They really know where to look for the root causes underlying a lot of chronic illness. We ourselves run a completely online functional medicine practice, so if you do need assistance, we can help you wherever you are. However, if you would prefer someone more local to you or see them in person, then you can use something like the IFM directory to find someone. It is a journey, and if you're already tired on that journey of researching and working on yourself already, get your support system in place, get someone to work with you to provide you support, and you can get better from this.